My name is Abico Binkley. I am an advanced practice registered nurse and a family nurse practitioner. I also hold an additional specialty certification in hospice and palliative care. Together with my social worker counterpart, we make up the advanced care planning team, where we speak with patients and their families about their treatment plans, their goals, and their wishes.
Hi, I'm Genevieve Introcaso. I'm a licensed clinical social worker and also hold a certification in hospice and palliative care. As Abico shared, we together are the advanced care planning team and palliative care program for the VNA. We are honored to identify the goals of our patients and to advocate that their plan of care always is in alignment with their goals.
I have been a nurse practitioner for 16 years, and most of that clinical experience has been caring for very ill patients, critically ill patients, often with multiple comorbidities. And what I've seen year after year is that patients really need additional help dealing with their disease processes towards end of life. We have specialties that deal with all of the different parts of the human body. There are cardiologists for the heart, pulmonologists for the lungs, we have kidney doctors, we have liver doctors, and so forth. And hospice and palliative care is really the specialty in providing compassionate care to the whole person at end of life.
My first 4 years with the VNA was actually spent as a hospice home counselor. So I was honored and blessed really to see the benefit that hospice provides to our patients and families. Not only the hospice benefits, but even within that, the improved circumstances that advanced care planning afforded families that had these discussions and conversations proactively. So when given the opportunity to pursue certification in hospice and palliative care, it just felt like the next right step. It would make me better equipped to ensure that all of our patients and their families receive not only hospice benefits, but the benefits of advanced care planning sooner and more fully. National Healthcare Decisions Day is so important because it serves as a much needed reminder of the importance of advanced care planning really for everyone.
These conversations can frankly be uncomfortable, and often people want to avoid them. We like to empower our patients not only to think about their wishes, but to have the conversations and fill out the appropriate documentation and to make their wishes known to both their healthcare team and their families. Any person who is 18 or older needs to care about advanced directives.
And advanced directives really are just the written document that gives the opportunity to express what types of healthcare treatment we would and would not want. In the state of Florida, we often utilize the 5 wishes, which would serve as both a living will and healthcare surrogate form. The healthcare surrogate simply being the person that you choose to advocate for your wishes if you're not able to do so on your own behalf. Another form that Abico and I often educate about within our patient interactions is the do not resuscitate form. There can be a lot of misunderstanding about all of these documents, and we encourage not only to have the conversations with your healthcare team, but also your physicians to ensure that what your wishes are honored.
An advanced directive gives you a voice if you're unable to speak. Remember, it's better to be proactive than reactive when it comes to these sorts of decisions. In my experience as a nurse practitioner, I have seen countless patients and families having to make very major decisions in the face of a crisis. Doing advanced care planning ahead of time, completing your advanced directives proactively alleviates so much burden, so much stress and trauma sometimes from both patients and their loved ones.
Having the conversations, including in advanced care planning and completing your advanced directives, really is a way of saying I love you to your family. It offers them the gift of reassurance that they're making decisions based on your wishes.